So Patrick, thank you for coming today to my clinic, the Esho Clinic. How are you feeling?
I'm feeling good. A little jet lagged.
No, I can understand. So everyone knows you as the CEO of Celluma and the inventor of the product itself. But for those that don't know, please tell us a bit more about the creation.
Yeah, 12 years ago, I was the CEO of a orthopedics company,
Okay.
and I felt like I wanted to make a bigger contribution to the world and to particularly wellness. And I stumbled onto the vast clinical literature in the area of low-level light therapy. And honestly, I was really skeptical,
Yeah.
thinking, okay, we're going to be healing the body using light energy. But it turns out it works.
Yeah.
And the problem is it was very expensive to access. Large machines costing anywhere from $12,000 to $25,000. That made it really only accessible in the clinic. And even at that point, the economics didn't work. That given the cost of the machines, they really couldn't pay for themselves. So, people didn't have access to that broad therapeutic benefit of low-level light therapy. So we set out to build a device that could provide those therapeutic benefits, but at a price that would be affordable to the masses.
Yeah, no, that completely makes sense because for me as a practitioner, LED, I was first skeptical as well. I thought, light, how much can it actually do in terms of rejuvenation? Right. I'm almost like I need to feel it working or see it working to happen. And that's for a lot of clients.
Yeah.
So when they come in, I don't think they appreciate the benefit that it does. But as you say, when we've got these huge machines in clinic, but how much we actually charge for the patient when they come in, the cost analysis doesn't make sense. So making it more accessible is completely correct. So for you, how did you then take that? Like, what was the idea? How did you go, right, how am I going to make this affordable and accessible for people?
Well, I think the thing that, and it basically came from my background in orthopedics, where we treat post-op surgical sites with thermal devices, cold and hot devices, to manage pain and accelerate healing. And it just struck me intuitively that that's the way a light therapy device should work. It shouldn't sort of stand off from the patient, sort of more like a French fry warmer than a medical device. I thought that the device should wrap and contour the area of treatment. And it turns out that there's a law of physical optics called the inverse square law that says if you can move the emission of light energy closer to the surface of absorption, you don't need as much energy, and that way you're able to take cost out of the product. So rather than having a big machine that sits on the counter or a worse on a stand that takes up a lot of room in the clinic, we were able to devise a device that delivers an efficacious dose. More importantly, is safe in delivering that dose, but is very affordable because it doesn't need to have the great big boxes and cooling fans and articulated arms. It conforms right to the area of treatment and stays where you put it.
So basically you deconstructed what we knew down to the finer points and made it more ergonomically designed, but more efficient.
Yeah.
And I think that's what I love when I see the design, the ability for it to flex around different contours, because patients are all different.
Right.
I look at myself, I've got a large head. So when I actually use that device, I actually like it because it matches the contour or wherever I want to put it on my patient or on myself as well. So obviously you've got go through what current devices you have now for those that don't know, because I'd especially please go to the full body one, the one that I'm wanting for myself at home.
Yeah. So I think there are now 14 different versions of the Celluma.
Wow.
But from an efficacy and a safety standpoint, they are identical from a therapeutic program standpoint or protocol. The LEDs, the intensity of the light energy, they are all identical. How they differ is in their treatment area size and in the modes of treatment. So we have devices that are single mode treatment. So for instance, we have a small panel for treating just acne because we wanted to make that product very accessible to the acne patient. Celluma Pro, it treats aches and pains, it treats wrinkles and fine lines in the skin, it treats acne, and it's also medically CE marked for dermal wound healing, post-op, and it's the only device in the world that actually has all of those credentials. And so we have price points that range from about 300 pounds all the way up to 15,000 pounds for our full body device.
Yeah, I saw that. I need to get that, by the way, so I'm going to be hitting you up after this, 'cause that looks amazing.
Yeah, and it's great. I happen to have one at home.
Yeah, I want one at home.
And I'm an active cyclist, and I use it both prophylactically and for recovery. I hate climbing.
Okay.
And so when I know I'm going to go out on a route that's got a lot of climbing to it, I will use the Celluma ahead of time, just to sort of get everything going and get the metabolism activated. And that really helps my riding. And then when I use it, when I get back, it's like I never went on a ride.
That's really interesting, because I've never thought of using LED therapy in that way. I think if I look at how I've integrated Celluma in my clinic, it's always been post treatment or as an adjuvant to skin rejuvenation. So actually possibly using it before I do a treatment, because of what it has on its effects on the blood flow, could improve things, particularly with laser. I'm going to take that away.
And not only increasing the microcirculation, but in knocking down inflammation. We all walk around with a lot of inflammation. It's at the root of most of the things that ail us. So if we can knock down that inflammation and increase the microcirculation, start delivering more oxygen and nutrients to the tissue ahead of physical activity, we're going to perform better. And following it, we're going to recover faster.
Wow. I don't think a lot of people probably have taken that point on, so that's actually a good learning point.
Yeah.
Now, I do have a question for you, because a lot of people knew on social media that I was going to be speaking to you today.
Yeah.
And one burning question was, particularly for people from my skin color, from a high Fitzpatrick type, there's a lot of talk between blue light causing hyperpigmentation. What are your thoughts on that, and what do you understand about it?
Yeah, I actually wrote an article on this. I think it was called "Much to Blue About Nothing."
Oh, nice.
It's really an urban myth that was sort of promulgated initially by companies that made ambient lighting. That as the lighting world migrated to LED lights, the incandescent light bulb companies and the fluorescent light bulb companies went, wait, this could be dangerous. And so there were just a handful of papers out there that said, over 20 years, if you were constantly exposed to densities of blue light that are probably orders of magnitude greater than what's emitted from the Celluma, you could potentially have hyperpigmentation.
Okay.
So, and then really the skincare industry got a hold of that and went, oh, well, here's an opportunity for us to make some, blue blocker topicals. Yeah. And so when you really get into the science, and some of the best science has actually come out of the skincare companies in Europe, there's nothing to it. Now we know that the closer you get to the peak absorption point in blue light, which is 415 nanometers, two things happen. One, you're very effective at killing porphyrin acne.
Okay, yeah.
But you're also increasing the likelihood, although it be rare, of triggering hyperpigmentation in Fitzpatrick 4 and 5 skin types.
Okay.
And so that's one of the reasons we use a 465 nanometer wavelength in the Celluma, because we know it still kills C. acne bacteria, but we're back from the absorption peak. So we're less likely to trigger that hyperpigmentation. And even if it is triggered, it's transient and it's going to resolve in a couple of weeks.
Amazing.
So I would say, in general, blue light is safe for higher Fitzpatrick skin types, and using a blue wavelength that is further away from the peak absorption point decreases the likelihood.
Amazing. I think that demystified a lot, and a lot of people are going to really appreciate that, and that's great. And particularly knowing that the products aren't just targeted at typically Caucasian, so all skins, I think that's really important. That's an inclusive product, and people are going to love to hear that. Now, in terms of what's the future for Celluma, so I've got my own product range, and I'm constantly trying to innovate. I'm looking at trying to bring the clinic into people's homes. I think that's what we've seen, particularly since the pandemic. For Celluma itself, what is the future, and is that on its horizon?
Well, absolutely. I mean, all of our devices are already either FDA-cleared or medically CE marked for at-home use or over-the-counter use. So you don't have to be clinically trained to use our devices. And in some instances, like hair restoration, the protocol is every other day. So you kind of have to have it at home. We have a couple very exciting products in the hopper.
Okay.
One that will be coming out before the end of the year. We can't talk about it.
I was literally about to ask you, do I get the scoop? Can you say to me? We might say off camera, people. I'll hear it, in that way.
So we can't get too far in front of our regulatory clearances. But again, recognize we only talk about what the regulatory agencies allow us to make claims about. You can find lots of light therapy companies out there that will make claims and invent conditions, to sort of claim that their device treats more. And it's, we take the high road, and we only talk about what we're permitted to talk about. And so there's a couple new indications for use coming. Again, hair restoration
that's a huge topic right now. Unfortunately, too late for me.
No.
Never too late for me. Never.
No.
Okay, all right. I'm gonna keep your word on that.
Unless you painted that.
Yeah. I got. So this is a scoop I'm gonna say. So all my hair hasn't gone. Some of it is semi-permanent tattooing in the areas. Some of it in specs. But I've heard it from the man himself. It can work on me, so I'm going to try it, and I'm going to let you know the results. Okay. Well, thank you so much for coming today.
Absolutely, my
Honestly,
pleasure.
you've hit some topics, and you busted some myths to me, and I'm excited for the future. And obviously, off camera, you're going to tell me what those future developments are. But I hope to see you again.
Okay.
Thank you for joining us.
Thank you.
Take care.